and welcome back to The Big Question. Today I'm going to be exploring the beauty industry. And when I talk about the beauty industry, I'm talking about the aesthetic industry. People who do procedures such as Botox, fillers, and other cosmetic changes. I'm not talking about surgery. We haven't gone down that path just yet. And I thought it'd be a really good idea to start with a good friend of mine, Dr. Stephanie Damalis. Steph, I met by chance. We were both walking our dogs in the local park and we got chatting. And I said, "What do you do?" And she said, "I'm a doctor." And I was like, "Oh, a doctor." And of course, as soon as you think of doctors, you think of people who work in hospitals or GPs. But she said, "No, I'm a doctor of aesthetics." And I was like, "What's that?" And then she filled me in. And I'm not going to tell you too much about that because I can leave the expert to do that. But the reason I wanted to talk to Stephanie is in doing this personal journey about my nose, I wanted to think about how other people look to having certain cosmetic procedures to make them look better or feel better. I think 20 years ago, the word Botox or fillers were just not in people's everyday vocabulary. Whereas now I feel like everybody's having it. And I'm not going to be shy to say I have had it because I have had it. And I'll talk about that a bit later. But yes, I don't think people realize that most people have had it, especially women, I would say. Women over the age of 30, probably most women are thinking about or have had some form of Botox or skin cosmetic change, I suppose. I'm not using the right words. I'm sure Stephanie will use all the correct words. But I think in today's world, it's become incredibly acceptable until the point where you see people walking down the street with overfilled lips and cheeks and too much Botox where they can't even move their eyebrows. I'm moving my eyebrows up and down just to prove to you that I haven't been overfilled. And but it all feeds back into this idea of beauty and beauty on screen, what we're seeing on our TVs, what we're seeing on social media, what we're being told is beautiful or acceptable. And of course, that feeds back in society. So that's really why I wanted to talk to Stephanie, Dr. Steph, as I like to call her, because she is seeing people every day in her clinic who want to, for whatever reason, look different. So I will leave it at that, apart from I am interested in how we can change our face to make ourselves feel better. But from a personal point of view, think sometimes people can take it too far and they stop looking like themselves. And for want of a better word, they can look like a caricature of themselves. And that's been one of my fears. And I think it's a really unethical practice when certain beauticians or doctors take it that far. But perhaps that's my judgment, and I should revert. Oh, I can't say it. I should reserve my judgments because people might be thinking the same as me, like, how dare she have Botox? She should age naturally with all those wrinkles, and she shouldn't have a nose job. So, yes, I will not be judgy. Let's go and meet Steph. Hello, I'm here today with Dr. Stephanie Damalis, a doctor of aesthetics.
That's
I said
right,
it right.
yes.
So, Stephanie, can you tell me what got you into becoming a doctor of beauty and aesthetics?
Yes. So I did my medical training in Cape Town, but I knew from an early stage that I didn't want to be a hospital doctor. But it was difficult for me to understand where I was going to go. How was I still going to use my skill, still help people, and do something that I enjoyed? And in my late 20s, I must have been around 27, 28, I developed adult acne. And I'd never struggled with my skin before, so it was something quite new to me. I remember it affecting my self-esteem, my confidence. I tried various products on the market. Nothing made my skin better. In fact, I actually think it made my skin worse. I had to start wearing makeup to try cover up my skin, which I think aggravated the problem further. And one of my friends suggested a skin course to me. And I thought, oh, maybe this is something that I'd be interested in. I went on a skin course and I tried some of the recommended products. These were more professional products rather than over the counter products. And my skin actually improved. And I thought to myself, well, I find this very interesting. I will be able to help people, try help people that don't have to go through what I went through. And I think the love for skin and aesthetics started there.
Wow. Really a career for helping people as opposed to just a medical side of thing as well, or both.
Definitely both. And I think that medicine is always both. Anyway, I still find this a medical career. A lot of people just think it's about beauty, but there is a lot more to it than that. There are lots of risks involved as well. But I've always wanted to be able to help people when I was a doctor in the hospital, but also in my clinic.
That's great. You must have seen a lot of trends over how long have you been in the profession?
So since 2017.
Right. So that's a long time.
Yes.
What have you noticed over 10 years of being in the industry in terms of procedural trends? Is that a word?
Yes.
Or what people are asking for? What have been the big differences or changes you've seen?
Amazing. Well, I think there's been a lot of change for the good. There's still some things around regulation, I think, that are lagging behind. But there's definitely been a trend towards more natural treatments. We are moving away from overfilling faces. People don't want to look like they've had a treatment anymore, and which is a great thing. So we're looking at more treatments that are beyond surface level correction. We're looking at trying to influence cellular behavior and trying to get cells to behave in a younger manner and therefore reduce the signs of aging. So things like regenerative medicine has become very popular lately. I would say really over the past 5 years, that's been, people are asking for treatments that offer true regeneration. And what that means is that we're using systems that already function in our body. So our body has the ability to heal and repair. And we're just using treatments that make sure that those repair mechanisms are working effectively, because as we age, they decline in function.
So would you say the demographic that's coming to your clinic is older demographic, so middle-aged plus?
Yes, I would say
What
majority
age?
is 35 upwards in my clinic. And so it's a good time for them to start seeking treatment because they are starting to see signs of aging. The signs are still relatively early, and so it's easier to treat them. And they're looking for treatments that are more subtle in nature, won't change the way that they look, their facial structure too much. They're willing to wait for results and put in the effort, whereas previously people wanted a quick fix. They wanted to walk out of the clinic and look different. And there's definitely been a change in that pattern. So people are more invested in their skin and preventing rather than trying to correct once the damage is done.
But I have noticed a trend on social media, and I've seen it in public on the street, for young girls, I'd say in their 20s, having certain procedures with overfilling lips or quite a modification in their looks. Have you had that trend in the clinic? Have you seen that here? Or
I certainly see it on the streets. I agree with you. And I think it's also why particularly filler has a bad reputation, because we see the bad filler. We don't see the good filler because it goes unnoticed. I think that trend is slowing down. We do still see it. The type of patients that I attract are not those type of patients. And even if somebody came into the clinic asking for those types of lips, it would be something that I would not do. And so I think just the way that I come across in my social medias and the kind of referrals I don't get that type of clientele. I think that's on the practitioner, because the practitioner needs to say no. I'm not against treating younger patients if there is a need for it, but with the younger patients, it's generally more a focus on their skin and how they can improve the health of their skin rather than injectable treatments.
if they came to you with a need of, I need filler in my lips because I'm feeling very low in my self-esteem, how would you deal with that?
It's very interesting because often patients will come to me with a request or something they think that they need. And very often we don't end up doing that treatment because I will need to look at their face holistically, see what their skin looks like, how their face is aging, their facial shape, their facial structure. And we talk about what I think is going to improve the way that they feel. And I think it's more based on feelings. I feel tired. I don't feel like myself anymore. And it's not always big lips that is going to make them feel better about themselves. So I think it's more empowering the patient to understand or help them understand potentially why they're feeling that way and offer suggestions that are going to actually benefit their face.
I mean, to me, that sounds like an incredibly ethical practice. And that's why I like coming to see you as well. But um, obviously, there are people out there who are just happy to treat anyone for the money. Like you said,
Absolutely.
regulations, standards needs to change with that. But it's lovely to hear that you would look at the patient holistically, and like you said, bigger lips aren't necessarily going to make you happier. So we've discussed the trends on the street, what we might see when we're walking around, but what my podcast is about is how I feel screens such as TV and film and commercials do not represent what I feel is a diverse look. I think there are certain beauty standards that are across the whole range of commercials and TV and film, but they tend to have, I think, very balanced faces, which has been proven. I think they did some psychology tests on children and asked which faces were, like under fives, they said which faces were most beautiful, and it's usually the most symmetrical and balanced face. But for me, I find it problematic because my nose is probably not considered balanced or symmetrical in terms of what we're seeing on the screen. Now, I'm interested, obviously, I understand it's your job and profession to make people's faces perhaps more balanced, symmetrical, but what do you see as a reflection on TV and film as to what you would do in the clinic? Or how does it affect you? Are you trying to recreate something they might have seen on screen?
So, lots of interesting
Yeah.
points there. I think when people come to me with a picture of somebody, a celebrity or otherwise, and say, I want to look like that like this picture, that's quite scary. And very often we can't get them to look like that because everybody's face is different. I think being in the limelight is there's a lot of pressure for celebrities to not age. And we see a lot of celebrities, both men and women, that are seeking surgical treatments at a younger age now because of this pressure. So I do think symmetry is beautiful to some degree, and I'm always looking at proportions of the face. But I think we are all asymmetrical, and I think it's our asymmetry that actually truly gives us our unique beauty. And I have a skin scanner in the clinic, and when I can scan your face and I can make you symmetrical either on your left side or your right side, and when I show my patients this, they look quite strange.
Interesting.
And so sometimes correcting asymmetries, I always have this discussion with my patients. If their one brow is lower, which most of us have, or they have some asymmetry in their face, if I just go ahead and correct it without having that discussion, when they look at themselves in the mirror, they feel like they don't look like themselves because they look quite different to what they usually see themselves.
And on that point, I remember when I studied art history, the two most beautiful paintings, well, considered classically, were the Mona Lisa and the Venus de Milo. And apparently, if you look at their faces, they're not symmetrical. So is this idea of symmetry something we've been taught, or is it easier to look at?
It's the idea of beauty, but I think beauty has so many meanings, and everybody beauty means so many things to people, different things to different people. So I think having some symmetry and balance is beautiful, particularly when it comes to maybe the lower third of the face. If our lower third is quite short or our chin is far set back, then having those kind of balances and proportions more aligned with the rest of the face can really enhance a facial look. But I think we need to not chase too much in terms of symmetry.
Wow, it's fascinating. We could definitely get into this more. I think we need to see some of the clinic, the photos of this symmetry, so we can see if, like, for example, if I had suddenly a balanced face, would it be more appealing or attractive or less. So going back to this screen idea,
Yes.
do you see proper diversity on the screen, or do you think there's this standardized beauty? Let's look at, I'm looking at the female, because I think the male's very different. I'm talking about female celebrities. Let's take Hollywood. Do you see a diversity of looks?
Not really. I think everybody is looking for a very snatched jawline. They're all looking for minimal wrinkles on the face, tight skin in their neck. And so everybody kind of goes for that same look. We see very bad work in the celebrity world as well, unfortunately. I think that is slowly changing. But just because somebody has all the access in the world to treatments, it doesn't mean that they are done in the right way. So I don't think there's enough diversity, and I think the celebrities are under a lot of pressure to not age, and so they have to take drastic measures sometimes to ensure that. And I think that's what we're seeing in the celebrity world.
One of my issues is obviously my nose. That's the big question. I personally don't feel you see noses of character in Western movies. I have noticed in European, French movies or French TV, you do get noses of character.
Yes.
But in Hollywood and in Britain, I personally don't see it. And I am always looking.
I guess that's the trend with noses, and it's the Tinkerbell nose that everybody speaks about. So a very slim nasal bridge with a turned up nose. And you do see that when celebrities have surgery, they all go for that same look. And again, I think it's based on the practitioner that is pushing this look forward, and social media that's creating that this is the idea of beauty when it comes to noses. And I don't think that's right. I don't think that there's one size fits all when it comes to beauty.
And that's one of my big bugbears, that then I look at the males in Hollywood or in the West and across Europe as well, and they often have big, giant, characterful noses, and they play heroes and love interests, and they're gorgeous, whether it's Tom Cruise or Owen Wilson. But I just don't ever see that reflected in the female.
I agree.
And that's part of my issue, is if I do feed into that by changing my nose, then I am literally just pushing that same dialogue along, that we must conform to be what's considered beautiful on screen. So it's a big, difficult one, which is why I'm talking to you today about it. So we touched on this earlier about having what I would call a positive impact on people. When you were younger, you decided to look into treatment for your skin, and it had a positive impact on you. Can you tell me more about the positive impacts you have day to day with giving people aesthetic treatment, but also not saying your negative impact, but any negative impact you have seen in the world of aesthetics?
Yes, so I think a lot of positive. A lot of my patients are perimenopausal, postmenopausal, and the common theme is I don't look the way that I feel. I look in the mirror, I don't recognize myself anymore, and I want to look the way that I feel. I don't feel sad, I don't feel tired, I'm sleeping, but I just look at people are always asking me this question: why are you so tired? Have you not had a good night's sleep? And it's not true. So people want to look the way they feel. And so when I can do that for someone, it is absolutely incredible. And I get endless comments about how I've impacted their life positively. They feel, it's not only about other people giving them compliments, but it's about making them feel good about themselves when they look in the mirror again. So for me, that's why I love it. But also,
I can testify for that. I know when I came out of lockdown, I had a very heavy lockdown, and I didn't get any sleep because I was doing Zoom parties online for what must have been the best part of a year. And I really did come out of lockdown. I look at my photos, I was so tired. Like my whole face just was so aged and tired from 1 year. And then I met you. And I remember people were like, Jess, you look great. But it's not that they ever said, have you had Botox? Have you had fillers? No one ever said that. They just said, oh, you look well. And that was exactly it. I felt well. I was eating well, exercising, sleeping. I was tired because of my life.
Yeah.
But I felt more tired every time I looked in the mirror. So for me, that was a huge positive impact you had on my life. and on my career. It meant that I could do more parties and do more shows. So it's been great for me. So in terms of negative impact, where do you see how Botox, fillers, other treatments could have a negative impact?
Yeah. So I think when it's done in the wrong way, so obviously with all of these treatments, there can be complications, and they can be devastating complications. So that can have a really negative impact on somebody's look. But also when people get too addicted to things and they start chasing perfection, and it's quite common. There's something called body dysmorphic disorder, which is quite common in our practice, even more common amongst practitioners in our practice. And so it's about being able to say no to those people. And that's our responsibility. So I think people can become obsessed with things with a single line in their head, on their head, or this on their face, that doesn't really, to you and I, we wouldn't really take much notice of it, but for them it becomes an obsession, and it's all that they notice. So that can have a really negative impact on people. And I think social media creates this idea of perfection, that we have to have flawless skin all the time without pores, and the makeup has to sit on perfectly. And that's just not normal. It's just not reality.
Yeah. Well, thank you. That's a whole other thing, social media, that we haven't touched on. We might if we have time. So you mentioned social media.
Yes.
That has got to have had a massive impact on your business. I know that as soon as I started talking to people about having Botox or filler, I noticed the algorithms changed on my Instagram feed. I was suddenly getting delivered more and more images of people who had had work done. Also, because I am very interested in celebrities who have had it. Once I searched like Zac Efron, and I saw what he's had done to his face, which really upsets me because he was so beautiful. And like you said, maybe body dysmorphia for him, someone said something, it planted a seed, and he's searching for something, I don't know what. But yeah, as soon as you mention it, you're fed so much on social media, and I'm so glad I didn't have it when I was a teenager.
Oh, me too. I think it's a very difficult world to navigate, and there are big positives about social media as well. I think for businesses, it can have a really positive impact. But as you say, you get fed information that is not necessarily true. And if you don't have knowledge in the field, it's very difficult to distinguish what is possible and what is not possible. Also, influencers talking about skincare, very often they are young, they have flawless skin anyway, and these are the ones that are educating people about how to look after their skin. And so I think the norm is that skin has to be flawless without pores, and it's just not the reality. And it's not that we can't improve the health of our skin, but you need to be doing it in a healthy way, because skin is still an organ and skin can be damaged. And even for me, I've gone off social media a little bit, because when I look around, I see how fake it is. You see people that are posting things, but when in reality, their life is completely different. And that's another story. But I've lost faith in social media a little bit. And so I want to make sure when I post that I'm always authentic. And I think more of us should be doing that, and showing more of the reality, showing the highs and the lows, and not only the positives, because I think we give people a false sense of reality.
And have a responsibility to educate younger viewers. So if a 13-year-old is scrolling, having, say, an influencer who has had loads of work done and saying, it's just because I drink 5 liters of water a day, is really going to feed into someone's head, and it's misinformation.
Absolutely.
So I suppose you have a responsibility to educate younger people as well.
Noted.
Or educate people.
Yes, it's true.
Yeah. Okay, we're going to move on to the big question.
Okay.
Hey, the name of the podcast is The Big Question for a reason.
Okay.
The big question is, should I have a nose job? But I'm going to ask you for two perspectives.
Okay.
I'm going to ask you as if I don't know you, as if you were just doing it as a doctor's opinion.
Okay.
And then I'll ask you as a friend.
Okay.
Because I totally understand there are two different point of views. I mean, there are probably more point of views, but this is what I'm searching for. This is my search. So as a doctor, would you advise I have a nose job?
Okay, so I'm not a surgeon, so I just want to
Yes,
make that clear.
cool.
But the things that I would be talking to you about is, that surgery is permanent and it's a big decision. So it shouldn't be a decision that's made overnight. I know yours isn't one that you've been thinking about recently. And so a lot of thought needs to go into it. Also, any procedure has risks. And so I would be questioning you about, or talking to you about the risk, but asking you, if something went wrong, would it be, it's something that you have to be able to cope with and deal with, because things can go wrong. There can be complications. It's not mostly not the case, but you need to be thinking about that. And then thinking about finding a surgeon that understands your ideal outcomes. How do you want your nose to look? And not one of these surgeons that is following a trend. And I think that finding a surgeon that connects with your values is more difficult than it sounds. So it would be, for me, going to multiple surgeons and getting opinions until you find one that you can really relate to and trust. So should you, from a surgical point of view, I think it depends on how much it's also bothering you. If it's something that every morning you wake up, you have a focus on your nose, you look in the mirror, it's the only thing you notice, then it probably will have a positive impact on your life.
I think that's a very good answer. And as I've spoken to you before, I have been to see some surgeons who I came then straight away to you and said, look what they said. And I was really not happy with their opinion and what they wanted to do, because it wasn't what I wanted. And that did then put me on pause and then make me sort of do a bit more, I suppose, soul searching of what I really want. And as a friend, what would you say?
It's so difficult because no, it's okay. But I know you like this, Jess, and I think your nose is a unique feature of you, and it's so hard for me to picture you any other way. But as a friend, I think a very similar answer. If it's something that you feel is going to make you feel more confident in yourself, then I would absolutely say do it.
Thank you so much.
Pleasure.
I always get really emotional, like when people, it's just about support, isn't it?
Absolutely.
And knowing all the information and just having support from people on both sides. And I have to admit, all my friends and family have been so supportive. And very rarely people go, no, 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 don't do it. But at the same people always say, but I love you as you, Jess, or I'm used to you. Yeah, but that's what the question is about. So
Amazing.
Thank you for
Pleasure.
helping
Thank
me
you for having
look
me.
into it.
Thank you.
Wow, I hope you really enjoyed listening to Stephanie Damalis talk from her clinic in Wimbledon. If anyone's interested, by the way, she is amazing, and I have been seeing her for a couple of years now, and I totally agree with her. I think that having some cosmetic enhancements can really make you feel better about yourself and your self-esteem. When she said how people often go up to someone and say, "Oh, you look really tired," it can make you actually feel really crap. And that was a huge thing I noticed when I came out of lockdown. I mentioned it in the interview, but when I came out of lockdown, I really was tired. I had been working like through the night sometimes to do online shows to keep my company alive, my theatre company alive. So it was crazy. I was zooming to like LA at 3 in the morning and then like having to get up and deal with kids. So for me, when I came out of lockdown, I totally had aged, 100%. And then also with the last couple of years with my dad dying from dementia and my mum dying from cancer, I am absolutely amazed. I have never dyed my hair. I don't have any grey hairs, but I am absolutely amazed that I haven't aged more. And I really do believe that's a lot to do with what Stephanie has helped with my skin, in that she's given me the right products to take, from collagen to skin injections as well. And so I'm personally 100% behind that in terms of how it's made me feel better in myself. And also the reactions I've had from people, which again just boosts your self-esteem and motivates me to want to work more and go out more and work longer as well. Unfortunately, the job I do does highly depend on my face. So, yes. So, thank you, Stephanie, for making me feel better in myself and for my work. But it was also really interesting to listen to her talk about the ethics in her practice. And when people do come into the clinic and say, I want to look like this celebrity, and she would read that as a red flag, and that how she, and I'm sure many, many doctors in the industry or beauticians are ethical and do understand they have a huge responsibility to not letting people perhaps get into a spiral or out of control. Yeah, I'm rambling now. But the other thing in the interview she said, which really struck a chord, was obviously the personal moment when I asked her about whether I should get a nose job. And it doesn't get me anywhere nearer to the answer, but it does make me believe that people really support my decision either way. Why should that matter? Why should I really need support? Huh. Maybe that's something for another episode. Judgment, which I touched on at the beginning. Yeah, judgy people. We're all judgy. Yeah, maybe that's what I am looking for, some type of support. And people go like a fan club, a Jess fan club, going, yeah, 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 get your nose done, get your nose done. We'll still love you. Or the opposite, don't get your nose done. We love you as you are. I don't know. I don't know what I'm looking for. I still don't. But Steph did say she's going to try and get hold of a doctor who does nose, non-surgical nose changes. Again, I'm not getting the right medical terms here. I will wait and see what she comes up with. Thank you for listening to The Big Question. And I think it's fascinating to talk about all of these new cosmetic changes that we go through to make ourselves look better and hopefully feel better. So until next time, thanks for joining me on The Big Question. I'm Jessica Kingsley, your host, your investigator, and this is my personal story about whether I should or should not have a nose job.